We are talking COVID-19 today with Dr. James McDonald from the Rhode Island Department of Health. He joins us every Wednesday here on 12 News Now at 4. Dr. McDonald, thank you for being with us. Obviously, a lot on people's minds today, the day after the election. But we know that COVID cases are continuing to climb both here and across the country. And last week, Governor Gina Raimondo said we are now just weeks away from rolling back into phase 2. Do you think we're still on track for that, or are we successfully flattening the curve again?
You know, it's too soon to tell, Kim. And I think what we have to be conscious of is the cases are still going up. And I saw today we had 466 cases. Obviously, that gets my attention. Hospitalizations are still high. So, you know, this is a snowball running down the mountain right now. And one person can't stop a big snowball from running down a mountain. But a lot of people working together can. And we all need to do our part. And, you know, I want to thank Rhode Island yesterday because you guys got out and voted in record number. Public health loves it when people vote. We just think that's great because that's a good thing to do. But we all have to look at what we can do. How do we make the pandemic better? Is all of us doing our part? Because if you're not part of the solution, my friends, you know what you're part of.
Both Connecticut and Massachusetts have put in place suggested curfews from 10 o'clock at night until 5 in the morning. And we know that the governor is going to be having another press briefing tomorrow where she's going to announce potentially more restrictions. So I'm wondering if you think from a public health perspective, if a curfew from 10 to 5 would actually help slow the spread of COVID, and how likely it is you think the governor will announce something like that tomorrow.
Yeah, Kim, we're in an uncomfortable time, so we have to entertain uncomfortable options. So I understand why Massachusetts and Connecticut has done that. And the concept is just limit folks' movement so they're not going about so much. And obviously between 10 at night and 5, it obviously wouldn't apply to people who are working if that were to occur here. But if people are going out for recreational reasons, if they weren't doing that, it would eliminate some risk that we're having right now. What the big risk I see right now we're having is too many people having too many contacts. And too many contacts means you're within 6 feet of someone for 15 minutes or longer. And we have to kind of cut that up a little bit. We can't have that going on. Like right now, I can tell you, Kim, the only person I'm a close contact of is my wife. Otherwise, no one else is that close to me.
So, Dr. M, do you think we are headed towards the governor implementing a curfew like that?
I think it's an option that's going to be considered. And you know, I haven't seen what tomorrow's press conference looks like, but I wouldn't be surprised if that was discussed.
Dr. McDonald, there was a report earlier this week that Rhode Island has changed its guidance on quarantines, extending the quarantine period from 14 days to 24 days. Is this an accurate report? Yeah,
so I think there was a misunderstanding there. So there's been no change in how we do quarantine. The reason for quarantine is the incubation period of the virus is 2 to 14 days, but after your last exposure. So if it's someone in your home and you're living in the home with them, you're exposed because you live in the home with them, and that's at least 10 days. So then there's 14 days for when. So your quarantine doesn't start really on the 14-day part till the 10 days is done. So you really are quarantined for 24 days if it's a household contact, but that hasn't changed. We've been doing that right from the beginning. So that's something that maybe people didn't understand, but it's something that happens. Because really keep in mind, quarantine really has to go until 14 days from your last exposure. If it's someone who lives inside your house, you're exposed every day.
Dr. Jim McDonald from the Rhode Island Department of Health. He joins us here on Wednesdays. Thank you so much for being with us this afternoon.